So the FMGE results are out and I'm going to check it and see my live score reaction. Hey guys, this is Dr. Subharamnani and I recently passed my FMGE in my first attempt in December 2021 without preparing for it, and I'm going to tell you how and how you can do it too. Yes, it's 100% possible. I've done it and you can do it too. And just hear out my approach, and if you can follow my approach, do that, because this approach is not for everyone. And if you do not fall in that category, well, I have some tips and tricks for you as well. So stay till the end of the video and yeah, let's go. So let me explain what does without preparing mean. Without preparation means from the time of my graduation till the FMGE exam, I did not study actively for this exam for even one day. That is like zero preparation. I studied in general for my upcoming exams, my future exams like USMLE. I'm studying for that, but I did not study for FMGE, and I still passed it, and it's completely possible, and I'll tell you how. So my approach starts not after graduation but in medical school itself. So if you also are a student like who wants to pass FMGE and does not want to grind for it in the last 100 days after your graduation, because you just have 3 months or something like that to cover all 19 subjects and you have to pass this exam. Now, believe me, you just have to pass this exam. You do not have to score a 250 out of 300. Treat this as a screening exam. It is a screening exam. The person who gets 300 out of 300 and the person who gets 150 out of 300, they are at the same level. There is no discrepancy in between. It's not like the person who gets 150 cannot get an internship opportunity. It's absolutely the same. So treat it as a screening exam. And as you know, screening exams are meant to screen, like they are meant to check your knowledge. And you have sufficient knowledge in medical school, and I'll tell you, you have it. You just don't know it yet. So hear out my approach. So my approach starts in third, fourth year of medical school, and we have a 6-year medical curriculum outside India, as you guys probably know. So what I did after my first, second, third year, we covered the preclinical subjects, anat, physio, biochem. We cover all these subjects in our first 3 years. So by the time you come to fourth year, fifth year, and you start rotations, you go to the hospital, you have forgotten most of that stuff. You are focusing on medicine and stuff like that. But to crack FMGE, what is most important? It's the basic knowledge. Because if you have this basic knowledge, you can connect the dots in the future. Let me explain how. If you know good physiology, pathology and pharmacology, medicine will be 100 times easier for you. If you do not remember these 3 subjects, medicine will be like a big mountain which is very hard to climb. So what I did was, in my 5th year, or I think like 4th year was not as productive, but in my 5th year, I started out brushing up my basic knowledge. That means physio, path, pharma, micro, biochem, and all the systems. So yes, I studied in a systemized manner in an integrated fashion. So I'll tell you what resources I use. For example, for physiology, for all the systems, so that means physio of cardiovascular system, physio of respiratory system, physio of renal, all the systems I divided into system, and I already have a video on it and you can check it out here, and I'll also link in the description that I studied in a system-wise manner, in an integrated manner. So I completed the physiology part from boards and beyond, since my goal is to give USMLE and it's an excellent resource for USMLE. It covered my basics of all these systems. For pathology, I use Pathoma, and for pharmacology, I use Sketchy. For immunology, biochemistry, though I did not complete it, I used Pixorize, and for microbiology also I did not complete it. I mean, I hardly started and did a few topics. I used Sketchy again. So this was to cover the basics. But you must be wondering, how come the basics can make you pass FMGE? FMGE has 19 subjects, and the preclinical part is just the first paper. In the final year, whichever college you are in your foreign medical school outside India, you have a final year exam in which you prepare. If you're in Ukraine, in Russian countries, you have something like Croc 2, if I'm not wrong. If you're in Armenia, you have your final year state exam, and so on and so forth. And for that, you really prepare for it. Every student has to prepare for it. It's their final exam. If you fail that, you do not pass your university, you do not get the degree. So in that, you must be preparing for medicine, you must be preparing for obs-gyn, and you must be preparing for surgery. So when you're preparing for these three subjects, prepare them so thoroughly that you do not have to touch them again. And if your basics are good, then gynecology and medicine will be so easy for you, because you would have covered most of it from your basics. All you'll have to study is obs, which will be completely new, like you would be studying in your clinical years, and surgery, again completely new, not something which you can connect from preclinical years apart from the anatomy aspect or something like that. So your knowledge pool, so let's say my knowledge pool before giving FMG consisted of: number one, the basics, anat, physio, path, pharm, a little bit of biochem, immuno, not much, hardly any micro, because I didn't do it, but you can if you're a third or fourth medical year student. And I did everything in the system-wise manner, so that helped me in medicine. So that was my knowledge pool, and then I studied for my final year exams, which consisted of medicine, obs-gyn, and surgery. So I have completed all these subjects, and I know all these subjects. Like, if there is a question, there is a good chance I will be able to answer a question from these topics. So that was my knowledge pool. Now, I feel this knowledge pool of these many subjects is sufficient to pass your FMGE exam. Now let me tell you why. If you've done these subjects and you've done medicine, you have actually done more subjects. So let's say you've not done ophthalmology, you have not done ENT and stuff like that, but you have done neurology from your pharm, path, from medicine, and that would cover 20 to 30% of these subjects as well. I'm not saying it will cover all, but it will cover some of the high yield topics. For example, if you've completed the musculoskeletal system, it will cover a lot of orthopedics. So if you complete these subjects in an integrated manner of systems, which will include physiopath, pharm in each system, which will include biochem, immunology, it will include microbiology, you can even throw in public health or biostatistics. A few questions of PSM would be covered from that, because you will cover all of epidemiology. And you top it off with your final exam preparation, which is medicine, obs-gyn, and surgery. This will be your knowledge pool. And this knowledge pool is more than enough to pass a screening exam. It is just a screening exam. If you're aiming for 200, yes, you will have to prepare for it. This won't cut it. If you want to pass it, if you don't want to waste time preparing for a screening exam, you would rather prepare for your future exams. For example, USMLE or PLAB or NEET, PG, NEXT, whatever you're giving. If you just keep preparing for that in those 3 months and not worry about these subjects which you've already done in your medical school, you will pass this exam. I am 100% sure about that. So now this approach will only work if you are currently in your 4th year or 5th year also, not if you're in your final year. That would be a bit tough. So you come after graduation, you have like 3 months, let's say a round off of 100 days, 120 days to prepare for your FMGE exam. What do? You do not remember much of physiology, pathology, pharmacology, and etc. and you really do not have the time to go through each and every subject individually. I mean, you will have to study like 10-12 hours a day. So what do you want to do? You want to also depend on your basic knowledge, which is less, and then fill the gaps accordingly. So what I recommend you do this, whatever basic knowledge you have of your final year exams, or even the basic knowledge from your med school, whatever knowledge you have, does not matter if it's 10% of what is needed in FMGE. Just give a mock exam. Give a mock exam. I don't care what score you get. You might get 50 out of 300, you might get 100, you might get even 150, you might pass in your mock exam. You actually do not know how much basic knowledge you have gathered along these 5-6 years of medical school. Okay, give the mock exam. See the analysis. See which subjects you could not answer at all, and see which subjects, if you answer some questions, those subjects can be almost perfect. Now you have to accept that this is your knowledge pool, this is where you stand, and you need these many marks to get over that 150 threshold. Okay, so you aim for a 180 mark or something, so you'll be safe in the exam that okay, I'm getting 180 consistently, I'll pass this exam. So accept that this is your knowledge pool, and now you have to fill in the gaps. How to fill in the gaps? Well, if you start studying each and every subject from scratch, it will be very difficult. So there is this last minute revision program and Vibe, which is the image based questions, videos regarding that. Basically the revision videos for FMGE from Dr. Bhatia Medical Classes, DBMCI. You can find an app, eGurukul, on which you can access all these videos. Why I'm recommending this is, first of all, you can buy these separately. You do not have to buy the whole subscription and get all the things they have to offer. You don't need that in 100 and 120 days. You just need revision videos to fill in your gaps. You need question-based discussion, and you need some Q banks. You can buy that separately from there. So these LMRP videos are basically short videos in which the teachers cover high yield topics, the topics which are most likely to come in the exam. So they will not focus on low yield topics, which will be focused if you want to study the subject as a whole, which I told you might not have enough time for. You do not want to focus on low yield information. You have to pass this exam. You have to get above the 150 threshold. If you just focus on the high yield stuff, which is most likely to be tested on the exam, you can do it easily. So in these LMRP videos, you will focus on the high yield stuff. Everything in those videos is important. Consider it important, because these are very condensed videos with a lot of information, and you have to basically learn that information by heart in those 100 and 120 days. You have to understand it, you have to do questions on it. So there is a lot to do in those 100 and 120 days. So utilize those short videos, waste less time on watching the videos, and utilize your more time in imbibing the information, in learning the concepts, in understanding the concept, in applying the concept through Q banks. And also do the image based discussion, which is the Vibe, because sometimes you just know the image, you do not have to even read the question or the options. Like, you have seen this image before and you see this image, and that's a major hint that this is the answer. So I would highly recommend, if you are in that last period, utilize the LMRP and the Vibe, which are last minute revision videos, and the image based discussion videos, and there is a good chance that you can pass. But if you focus on completing the subject, doing the full videos, you can do it. I'm not saying it's not possible. You have to study very hard for it. You have to work a little bit extra, because you'll be covering a lot of information. You'll be covering the information right from the basics. You will be covering the high yield information for sure, but also the low yield information, which is just needed to understand the topic maybe, or just to complement the topic, but not really exam relevant material. So this is why I'm saying and stressing, like I'm sounding like a broken recorder, that utilize the last minute revision videos, or revision videos basically, and the image based videos, and you can pass this threshold easily. And keep giving mock exams. Does not matter the score. Mock exams are the place where you can fail. You do not want to fail in the real exam. So keep giving the mocks every month. Every month you give each mock, and you will see your score increasing and increasing and increasing. Now this strategy and this approach is for people who are in the final year exams and have done nothing regarding FMGE prep. Just focus on your final exam. Do those subjects amazingly well that you do not have to touch them. Then in the 100 and 120 days you have, just focus on the revision videos, image-based videos, and you will be good to go. And for my friends who are in 4th, 5th year, follow my approach. Dive into your basics, understand the basics, and I'm telling you, the last 100, 120 days will be so easy for you. You might not even prepare for anything. You can just chill for some days and still pass the screening exam. And that's been it. And if this video helped you even a bit, please share this video, okay? If you're a final year medical student, share it with your juniors, share it with your 3rd, 4th year juniors who you talk to, who you like, and tell them that they can utilize this approach and their FMG's journey will be so easy. And if you are a final year student, or if you are a graduate and you have just some months to prepare for FMG, well, I have nailed down the approach for you as well. So don't forget to click on the thumbs up button, subscribe to the channel, and that's been it. Stay happy, stay safe, and stay mad, but just about medicine. I passed. Yes. I was feeling like it, but yeah, good score. No need to give FMG again, and I passed without preparing for it. So that's amazing.